Good morning, Chairman Hunt, members of the committee. My name is Kim Larson. I live in Seattle, Washington, and I've been a registered nurse for 17 years. Over the past year, my work has been harder than ever before. When the pandemic first hit, I was working at a residential psych facility for youth, serving both voluntary and involuntary commitments. It was a stress-filled living nightmare. Our facility was terribly unprepared to manage our first COVID infection occurring in the end of March. As a mental health facility, we, like so many places, had no or grossly inadequate personal protective equipment. Further, the failure to appropriately train our behavioral staff on the basics of PPE usage, infection control, or isolation precautions led to an outbreak affecting fully half of our residents and no small number of staff. Despite having COVID-infected patients, we continued admissions without a sound protocol for infection prevention. When staff were diagnosed, we received no notifications or contact tracing for the rest of us. Even more egregious is that a coworker who expressed concerns to management regarding his risk factors, making him more vulnerable to serious infection, was advised to just keep coming to work despite the fact that we didn't even have PPE in his size. In early April, I released him from work mid-shift and sent him to the ER for shortness of breath and a fever. He died 4 days later, almost assuredly from COVID that he contracted at work. I won't lay the blame at the feet of our administration. They're people like me who were trying to do their jobs in a terrible situation, but they were deaf to the concerns of the boots on the ground workers. I must speak out against the injustice of a system that values money, profits, and the bottom line over human lives. My coworker is dead because he couldn't afford to walk away from a job where his voice and his concerns were disregarded and his health and safety didn't matter. This isn't an isolated example. To me, SJM 8002 is empowerment legislation. It's about finding and centering fairness and justice at the most important level. It's vision of a more equitable system in which we each have a voice, the power and the possibility to influence what happens in and with our government, not because of how much money we have or what that influence can buy, but because as human beings, what each of us has to say matters and we deserve to be heard. It may be tangential, but it's all connected. I assure you the urgency is literally life and death, and I urge you to please support this legislation.